Hi, I'm Dr. Tom Wheeler, and I would like to talk to you today about the pelvic organ prolapse quantification system, otherwise known as POPQ. Now, this system tends to have a reputation of being confusing, but really it's a very user-friendly way of quantifying vaginal wall descent. The overall purpose is to stage vaginal wall descent by compartment, thinking of it as the anterior wall, posterior wall, and the apical compartment. And we use this to follow results of surgery, to do multiple exams to follow the progression of prolapse. We also use this in research, and it basically allows us to communicate our findings between physicians using a validated and standardized system. Now, to do the POPQ exam, obviously the patient will be in the lithotomy position or standing, and you want to have some way of measuring the degree of vaginal descent, and we do this in centimeters. Personally, I use a Q-tip, and I have it marked with little black marks for every centimeter. Other people use ring forceps, and these tend to have graduated marks already on them. Again, this is in centimeters. You'll also need a speculum, either a sim speculum, or you can just break down a speculum and use a univalve speculum. You also need a regular speculum just to measure the total vaginal length. Now, when we think about the POPQ, traditionally we think about it in 9 points, and usually we write it out in a grid. And this grid has 9 points to it. There's a point A, and this is for talking about the anterior vaginal wall. There is a point B, and then there's a point C. We also have a point A on the posterior vaginal wall, a point B, and a point D. We also measure the genital hiatus, the perineal body, and the total vaginal length. Another way of notating this is point A on the anterior vaginal wall as A sub A, or for point B, B sub A, and for the posterior vaginal wall, A sub P or B sub P. Alright, so what are these points? Well, point A sub A is on the anterior vaginal wall 3 centimeters proximal to the hymen. Okay. Point B sub A is the most distal portion of the remaining upper anterior vaginal wall. Point C is the most distal edge of the cervix or vaginal cuff scar. Point D is the posterior fornix, and is not applicable if you are status post removal of the cervix with a hysterectomy. On the posterior vaginal wall, it mirrors what's on the anterior vaginal wall. So point A on the posterior wall is 3 centimeters proximal to the hymen, and point B sub P is most distal portion of the remaining upper posterior vaginal wall. Genital hiatus is measured from the middle of the external urethral meatus to the posterior midline hymen. Perineal body is measured from posterior margin of the genital hiatus to the middle of the anal opening. And total vaginal length is the depth of the vagina when point D or C is reduced to its normal position. Now when we measure these points, points above the hymen are graded as negative and points below or past the hymen are positive. So when the prolapse goes beyond the hymen, those numbers are assigned a positive number. Points at the hymen are 0, and all points except for total vaginal length are done at maximal strain. So I'd like to redraw these points, kind of how they fall on the vaginal wall, and then we'll give some examples. So if we take a sagittal view of the pelvis, we have a bladder, uterus, rectum, and obviously the vagina. And remember, again, point A starts off as a point, a fixed point 3 centimeters inside the vaginal wall, and typically that corresponds to the bladder neck. B sub A, the most distal portion of the remaining upper vagina, can fall anywhere from here to here. Now I said it mirrors on the posterior side, so we start at a fixed point, A sub P for posterior, and B sub P. Point C is the leading edge of the cervix, or cuff, and point D is the posterior fornix. Again, genital hiatus from mid-urethra down to the posterior hymen, while perineal body is from posterior hymen to mid-anus. Now some things to realize with this scoring system. Since it is done with strain, what we are doing is not saying that A sub A is always 3 centimeters up. We're saying watch that point drop with strain. And since point A is a fixed point, and if there was no prolapse, its value would be minus 3, and it can go all the way to a completely prolapsed out, but since it's fixed, it's plus 3. B sub A, if it's the leading edge of the upper prolapse, if there's no prolapse, it corresponds to minus 3. But it can go all the way to plus total vaginal length. For example, if there was no uterus here, it was just the cuff. If the cuff came all the way out to here for the total vaginal length, it'd be plus total vaginal length. The same holds true for A sub P and B sub P. Point C can be negative total vaginal length if there's no cervix to plus total vaginal length. And obviously you would subtract out the length of the cervix if there was one. And the same holds true for point D if there's a cervix present. So here we go with some examples. Again, we'll draw our bladder, vagina, this time after hysterectomy, and rectum. And this patient has point A on the anterior wall there and point B there. And for the sake of consistency, we'll always say that there's a total vaginal length of 8, that the genital hiatus is 3.5, again in centimeters, So we'll go ahead, since we typically measure to the tenths place and round it to either 0.5 or 0. In the perineal body, let's say that is 4. So for a patient with no prolapse, obviously A sub A, B sub A, A sub P, and B sub P will all be -3. Because there would be no prolapse, it would be 3 centimeters away from the hymenal ring. And if there was no prolapse and the total vaginal length was 8, then point C would be -8, and we would have no point D because we're post-hysterectomy. Well, let's say that A sub A actually comes down a little bit. So I have a little bit of a cystocele, and so now this point comes down to right here, right at the opening. And let's say that the vaginal length drops 2 centimeters. So what are those numbers going to be? So we make our little grid. So AA made it down to the opening of the hymen, and so it would be 0. B sub A would be the leading edge of prolapse above that point or equal to it, so that would also be 0. Point C, well, if total vaginal length is 8 and it came down 2 centimeters, that means it's 6 centimeters away from the hymen. I already told you what GH was, and PV. And I also said we've had a hysterectomy, so there's no point D. And on the posterior vaginal wall, there is no prolapse with strain. So it states 3 centimeters for point A, and remember when there's no prolapse, point B equals point A. Alright, so let's do it on another situation. This time we'll make it a rectocele. Another good point to take home about this is that this system doesn't tell you if it's a rectocele, cystocele, intercele. It just tells you where the anterior or posterior or apical vaginal wall go to. It doesn't tell you the quality or the kind of prolapse. So let's say this time our prolapse does this. Again, 2 centimeters of drop. Our point A, this time on the posterior vaginal wall, comes up to the hymenal opening. So we'll draw our grid again. Alright, so A on the anterior vaginal wall says patient bears down. It doesn't go anywhere. So A sub A is -3. I already told you this patient's total vaginal length is 8. Perineal body was 3.5. I'm sorry, general height is 3.5. Perineal body is 4. So that's actually, I wrote that in the wrong place. So this is point C. So point C would actually be -6. So again, it is, the cuff comes down 2 centimeters, vaginal length was 8, so it's 6 centimeters away from the hymen, so it'd be -6. On the posterior vaginal wall, it comes down to the hymenal opening, so it'd be 0. It's also the leading edge of prolapse, so that'd be 0 and no point D. Let's look at another example. Let's say this time But our prolapse does this. Okay, so point A started here, 3 centimeters up, and this time it only comes down to there. So let's say it comes out 3 centimeters. But we have a leading edge of prolapse that's actually 4 centimeters out. And let's say, for the sake of discussion, that our cuff still comes down 2 centimeters. And we have no posterior wall prolapse. So again, draw our grid. GH, let's say our general hiatus is 3.5, perineal body still 4, total vaginal length is 8. The cuff comes down 2 centimeters, so it's 6 centimeters away from the hymen inside, so it's negative. This time point A is all the way out for as far as point A can be, so it's plus 3. But it's not the leading edge of prolapse above that. The leading edge is 4 centimeters out, so here it is plus 4, or 4.0. We have no prolapse on the posterior wall. And finally, I'll show you the situation of again an 8 centimeter vagina that's completely everted. So it's 8 centimeters this way. And these are actually the easiest POPQ points to get on an exam, because you really only have to measure total vaginal length and you got all your points. So again, total vaginal length is 8. Will be consistent with our general hiatus of 3.5 centimeters. Perineal body of 4. Point A starts here and can only go 3 centimeters out. So point A is 3 centimeters out on the anterior vaginal wall, otherwise known as A sub A. It's also 3 centimeters out on the posterior vaginal wall, or A sub P, P for posterior. Now, the leading edge of prolapse is all the way out, so it is 8 plus 8, and the same thing on the posterior wall. We have no point D, and right here the cuff should be also 8 centimeters out. So again, if you just measure general hiatus and perineal body, you know the total vaginal length, then you have all the other POPQ numbers for total prolapse. So kind of in review, it is not as complicated as people tend to think this exam is. Obviously, it's a lot easier to learn it doing it on patients. The American Urogynecological Society website does have measuring prolapse in the office tutorials. It's very clear and very simple to use, and there's a small fee for that. You need to remember what the possible ranges of prolapse there is. For point A, it's -3 to 3, and for point B, it's -3 to total vaginal length. That all measurements except for total vaginal length are with maximal strain. If you cannot reproduce that in the lithotomy position, feel free to have the patient stand up to do that. And other than that, I encourage you to use this system as a tool to track patient progression in your office and to measure how well your surgeries work. The pelvic organ prolapse quantification system does have a staging. It's really easy to remember how to stage pelvic organ prolapse, but there's a few things you need to remember. One, you just give one stage. You don't stage anterior wall as one, apical wall, posterior wall, and you also don't call it a cystocele, rectocele, interocele. Again, the POPQ system just tells you where the vaginal wall is coming down. It does not tell you what it actually is. So it's easy because all you have to remember are -1 to +1. Any prolapse that touches -1 to +1 or in between there is stage 2, pelvic organ prolapse. So it's going to be greater than or equal to here, or less than or equal to there. Alright? Anything above that will be stage 1, if there's any vaginal wall prolapse at all. Anything that goes outside past that, outside the vagina, would be stage 3. Now, there's a stage 0, which is kind of useless. Stage 0 means that AA, BA, AP, and BP are all -3, and that the cuff or the cervix doesn't move more than 2 centimeters. While most normal asymptomatic women have at least stage 1 prolapse, so in the future I imagine we'll probably drop stage 0. Stage 3 is anything past +1 all the way up to within 2 centimeters of total vaginal length. So in other words, if a patient's total vaginal length is 8 and they are out +5, then they're still stage 3. However, if their total vaginal length is 8 and they're out +6.5, that gets them stage 4. Again, we just call it one stage. We don't try to stage by each compartment. So for example, if a patient has BA of +3 and everything else is higher, she is still stage 3. In other words, +3, it's greater than +1, that's a stage 3 prolapse, even if there are other parts of the vagina that are well supported. And that's it for the staging criteria.